My niece has Angelman syndrome, which involves a developmental delay. So she would not have been at 3 months holding her head up or even crawling. She started to crawl within the last year, and she's just 2 now.
Right.
So how would you, with the baby program specifically, how would you address it? It wasn't something we knew until she was about 6 months old. How would you address that as you were going?
You can very quickly tell, after you work with kids for a few years, you will very easily tell the direction they're going. In fact, this is a tough part of my job because I work with so many babies. I very early recognize symptoms of certain conditions that the parents are not aware of. Everything from ADHD to autism, working with children for so many years. Remember, this is 25 years, and I am not a doctor, and I'm not saying that I am, but many times we've seen a child that we've watched for the first year, especially going into the second and third year, and we, as you know, as working with, what do you want to call me, a doctor? As a doctor, I've been able to sadly predict several things with different conditions like autism and things like that. So it's something where you actually just become very aware. If a baby is not doing a certain thing at a milestone, there's probably a reason for it. And some babies, 2 or 3 months is normal delay, and that makes sense. But when it goes on beyond that, then usually by then the parents are actually, probably much like your case, looking for doctors and trying to find out. It's usually the first child that they don't know what the milestones are, so they don't have any reference to work from. So if a condition is known, you work around the condition. We're going to talk about preemies in a minute, and preemies are a good example because people always ask, when should you photograph a preemie? A preemie gestationally is actually still developing until their birth, and it's going to come up, but basically we treat a preemie, we treat their birthday on the day they were supposed to be born, not when they were born. And so if they were born 6 weeks early, developmentally they're 6 weeks behind, and that's truly how it goes. When it's a condition outside of that, we have to just work around the condition.
So if, as far as the photography goes, if that the 3 month you were looking to do, their head up and that kind of thing.
And they couldn't do it.
You would just do
more like a newborn mother baby.
Right. Okay.
I would involve siblings, mom and dad, to give the baby some stability. And so everything, and that might mean that you do it twice, that at birth you've done mom and baby, and then at 3 months but you can change it up. Completely changing the background, completely changing the environment could give it a totally different feel. So yeah, we just work around it, yes.
Yesterday there was a little girl that during the shoot she stuck her tongue out. It was like a really cute moment.
That is great.
And then we had yawners, and so while you're shooting, are you thinking? You're thinking always to shoot to sell.
Correct.
So are there like little things like that don't sell? Like you'll shoot it, of course, but when you provide your images for your clients, do you leave out like little cute things like that?
I love those. I mean, we love yawning, we love little tongues, we love dripping drool, we'll leave that in there, but we're strong editors too. When we get to the sales part of this session, and I really beat you guys all up on how exactly many images you should show your clients and why, if you want to make more money, you have to edit and you can only show them a certain amount. You have to make artistic decisions. And so if it came down to it, if I had to add one extra, break my rule and add 1 or 2 extra images because they're just too darn cute, I would put them in. But you did see me catch a few yawns and catch a few, like he was sticking out his tongue. And there are 2 types of tongues. There's the cute little, tongue that gets stuck out because they're being silly. And then there's the baby newborn / 3-month-old, sorry to do that, that's so gross. But the one that's like the fatter tongue, tongue is fatter than the child's mouth and it just sits there. We're gonna talk about that one and cover that one, exactly how to take care of that one. Actually, I'm gonna tell you now because I'm not positive it's in the show. So if you have a baby that has that fat tongue that no matter what, their tongue is sticking out, the trick is tell mom, obviously don't do this yourself, ask her to rub the baby's tongue. Now, moms will always go like this and try to push it in, and I'll say, no, what I need you to do is take your finger, put it on the top of the tongue, and rub the tongue. What's happening is the baby there's a taste there, and everybody, when you taste something, you naturally pull in and try to swallow it. So when mom does that, the baby will pull the tongue in, do a sucking motion, which will close their mouth, and then the tongue will come right back out. So pretty soon then you've got a game going, okay, ready, mom? Rub, 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 snap, okay, tongue back out, rub, 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 and we do that. I mean, pretty soon moms are like awesome, tongue rubbers because they get the technique, but there are babies all the way up to 18 months that literally have wagging tongues with drool pouring down the side, and with older babies, like around 18 months, if it's the second child, because neurotic first child moms won't do this, but you take a lollipop and you can rub the top of the tongue. But realize if they want the lollipop, that's very risky. But better thing is like a little bit of sugar candy or something like pixie dust or whatever they call it, pixie dust. Hopefully that's not a drug.
Fun dip.
Fun dip, thank you.
Pixie dust.
Well, I don't know what's the new drugs out there. Something, it shuts them right down. But if you just put a little bit of sugar on their tongue or something, as long as mom's okay with it, that will definitely cause them to suck it in. So I'm going to recant the whole lollipop thing because that's too risky at that age. We do that at other ages for other reasons, but definitely something sweet that they will suck in, and that works really well too. So hopefully that helps. Pixie sticks, yeah. Pixie dust, pixie sticks, whatever. THC, I don't know, whatever. Whatever, it works. Okay, moving right along. Can we go to work now? All right, we are right where we were, right where your question led, which is preemies. We're starting off where we didn't finish off yesterday really quickly. I'm going to be pretty speedy today because there are just some key points that I want to bring out. Preemies, the gestational age is really the key here, understanding developmentally they are at their birth, you work from where they should have been born, and so you work that way. So if they're 6 weeks early, they're 6 weeks delayed, and that usually falls through the first year and sometimes into the second year before they catch up. Yes?
Would you do the preemie shoot straight up, or would you then wait for 6 weeks to do the
That's a great
newborn
question.
shoot?
Would we do the preemies straight away, or would we wait 6 weeks? That is the parent's discretion. Preemie straight away, most of these babies can be on oxygen, and parents have been very heavily told about RSV and things that could make the baby very ill and be fatal. So parents are very, very concerned about these babies. It is not my preference to bring them into the studio. Parents do it, and we let them know. We literally make sure there's not a sick person around. You saw those Clorox wipes. We wipe everything down. We have sanitizers. We clean ourselves. I mean, if we have to, we'll wear masks if we need to. But my preference is if they want to do a preemie shoot, they do have to pay for it, but we would prefer to come to their home, and we explain why it's a lot safer. So I love the preemie shoots are amazing, but I would prefer to go to their home. We also go to the hospital quite a bit. When we have good clients that have had a baby that's a preemie, we will, and usually we'll, in that situation, even though it's not technically a now I lay me down to sleep situation, we will waive some of the minimum purchases just because they're good, they're good clients. We want to take care of them as well. So home location to me is the better place to do it, but the client would have to invest in that for me to do it. The studio or the hospital, my preference would be the studio. I would rather not go into a hospital environment. Perhaps it's because I've been there for too many sad reasons. I don't enjoy that as much. I enjoy the birth part of it, but I don't enjoy the preemie part of it as much as I would outside of the hospital. Obviously, preemies are super tiny. All of the poses that we taught you absolutely will work, but it's a matter of you have to just shrink everything. The hand is literally the entire tool. So like pose number 2, we're talking right here, 2 hands, as opposed to this here. So just keep in mind, every pose will work, but these are tiny, tiny babies. Most, as I said, are on oxygen. They're very fragile. Babies, I shouldn't say fragile, they're actually very tough. It's amazing how strong these little people are, but safety is, of course, paramount no matter what. So working around things like oxygen, to me, people ask me, would you remove that? Absolutely not. That's a part. My son, actually, we're going to talk about him later, but was born with a very serious condition and was on oxygen for 18 months, and that's who he was. So I did not want that to not be a part of who he was. However, with preemies, keeping them naked is a little more risky. So if we have to use a blanket, we're willing to do so. I mean, it's about the relationship. And remember, these parents are usually very afraid. They've been schooled by the hospitals that this is a very high risk situation. So we don't ever want them to feel like they're putting their child at risk. After that, when babies get a little older, these are like the babies we had yesterday, so 5 days to 6 weeks. It's a great time to start capturing babies. I think we absolutely proved the point of a 6-day-old versus a 3-month-old. If you didn't catch that yesterday, you had to be sleeping because that 6-day-old, we could have done anything with her, honestly. The little nest, we weren't even going to attempt the nest, but I so badly wanted to show you how that was done. And she brilliantly did it, even after being here for so many hours, where the 3-month-olds, there was first of all, I couldn't fit them in there, and there's no way getting them to sleep is very, very difficult. So it's just, usually they're out completely the whole time. Parents do want to see the eyes if possible, so that trigger finger becomes very cognizant of that eye movement, because if they open up even for a second, you want to be there at that second. If they are awake, they're usually very listful. They don't move a lot, they don't do a lot, they just kind of hang out, and as long as they're fed and warm, they're really, truly very happy people. This is the stage that we get these magical shots, and I am going to talk about how to do this later, but this is what everybody wants. These are the images that hang in the hospitals and that everybody is trying to get, but they don't come easy, but they come a lot easier the younger the baby is. So this is where relationships are really important, because if you can work with your clients and tell them, again, we told you this yesterday, but we tell our clients at the pregnancy session or when they call, we let them know that they should book 5 to 10 days after. We say 5 days, but we say book your session 5 to 7 days after your baby is due. Very rarely does a baby go over these days in hospitals. Many times they come earlier, or they're brought into the world earlier, but that puts them right between 7 to 10 days old by the time that we see them, which is what we're really looking for. Again, they're just little sleepers. They just hang out. We can mold them. It's like playing with Play-Doh. They'll do pretty much anything we want. Shots like this are so much easier when they're newborns. This is a risk I would not take with a 3-month-old. On a little stool like that with that little basket, a 3-month-old kicks his foot once and that whole thing's coming down. I will remind you, mom is less than an inch outside of that frame. She is literally on guard, and when we're doing this, if you know the conversation I had about telling her if that baby hits the floor, we have it, and it's very serious, because I will never put a baby at risk. But at 6 days old, 5 days old, 10 days old, this is an easy shot to get. So choose your session times wisely. All right, let's get this shot over with already, shall we? Because I got at least 100 Facebook questions about that as well. This shot, the way this is done in, you know what, I think we packed the dolls, so I'm just going to talk you through it. This is actually more about patience than skill, is what it is, because the baby truly has to be completely asleep to make this happen. Now, the way you see that happen is watching their breathing. Babies have the same breathing pattern no matter where they are in the world. They breathe short breaths, and when they fall asleep, they generally take a big intake breath, and then they release, and then they start breathing very shallow. It's a lower, deeper breathing tone. So the way we do this, it certainly has to be done with a baby that's near asleep or all the way out. I think you can figure out the position the baby's on. The baby's actually on that posing pillow. Mom is holding the bottom, or an assistant is holding the bottom. Now, there are hands under this. Basically, mom has her hands under here, and I have her pinching the elbows together. And once she's pinched them together, if you've ever worked with a newborn, you know you have to actually get a crowbar to get those fingers open. And once we pry those open, put the baby's head. Now remember, he's almost asleep, but he's still a little wiggly. We start patting his back. So mom has her hands here, and of course we're patting the baby's back and getting him to sleep. So I literally am going like this, watching him breathe, 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 and as soon as I feel that, I feel his whole body literally sink down into that shot. And as soon as that's done, usually I keep her hands there because it's just easier, but I can also have her remove her hands, clean up the background. Once he's in that shot, I can leave them there for 15 minutes because they're asleep and the weight of their head is keeping their hands up. Now, we also do this shot on like a solid floor to where you can't have mom's hands pinching. What I'm explaining is this is a cheater shot, because in this case, I can get this very quickly and very efficiently and work with my hour time frame. To get a baby, and I'm sure you've seen them, the little toes are here and their little elbows are between their toes on a hard paper surface. That one's more challenging and takes more time, and the baby has to be completely out for that. It's the same skill set. You would hold the baby's arms in here, get the baby to sleep. Once they're out, you can get the shot, but I'm working on a time frame here, so to me, this is as powerful as that, and that takes 5 times longer for me to do. I love doing it, and if I have the time, I'll certainly try to do it, but this is a very, very sellable shot, and it's all about patience. We talked about this one earlier, and I said I would explain this one to you because safety is absolutely critical to me. I will never, ever, ever put a baby at risk. I'm very, very serious about that. This shot here, I'm actually in the image on the far side of the image, my right, on the far right of the image. I'm actually there, and the way we set these shots up, I want to clarify I'm not a fix-it in Photoshop person. My goal is never, you've seen me, I'm working lighting and exposure and doing the best I can, even in these conditions, to not have to fix it later. But in this case, I always love doing awesome, like, over-the-top cool stuff. And when you're working with babies, once you start pulling that camera back, your safety factor changes. The farther you are away, the more at risk that baby is because you have to change the elements. I'm not going to do that. So the way this shot was created, we set up the background and we set up the bike, and we lit the entire thing first. Then before the baby is brought into the set, we lock down the camera, we lock down the stand, and we take a shot of the scene. Then we bring the baby in. I was actually kneeling right to the side of the back of the motorcycle wheel. I'm kneeling there, and I laid the baby in, and he's asleep. This baby was probably 10 days old. He's asleep. He was a chunky little baby, but he's asleep. I have my hand on his back low, so my arm was technically coming right out of that frame, and I was kneeling and my body was there. We go ahead and capture those shots without moving the camera or the stand or the tripod. That is the key there. Don't move anything. Because then once you've done that, mom takes the baby out. Now I have a shot, a blank canvas basically with nothing in the shot, which is my overlay. And then I of course have the baby with myself in there. Now all I have to do is take that clean shot, lay it over the shot that has me in it, and quickly brush myself out. And it is a direct, perfect match. The reason I did this one is look at that background. With that detail, there's no way you can retouch somebody out of that shot. Not even a kneecap, because there's just too much pattern there. So this makes it really easy. Now, the trick that I want you to remember is take the blank shot first. You will never remember to take it last. We do that all the time. We're like, oh, we'll get it in a second. And then at the end, we're like, nobody got the shot. And if the lighting changes, I mean, you can get it close, but it's not perfect. So we always just say, hang on a second, let's get the shot, lock the camera down. Now let's do this. And then if you decide once, and just so you know, like we shot this and then we zoomed the camera in a little bit more, and then we took the baby out and shot the zoomed in version as well. Does that make sense? We can get a couple shots out of it, but I'm only really looking for one magical shot. And once I get it, I'm good to go.
Just a quick question, back to the
You still there?
Yeah, I had seen somewhere where someone does a composite of this.
Mm-hmm.
How is that done? Where they take two shots and then they erase, maybe someone's holding the baby somehow?
I haven't seen it. I would have to see it to know. So is that
I
something?
read a blog about it, and I was curious to see if you did it the same way. And the one shot, mom's hands were on the baby's like forearms.
Oh
holding
yeah,
him.
I've heard of
And
this.
the other one, the mom's hands were on top of the baby's head, so
that's
that
just
I used
time,
the
though.
two.
That's
Yeah, I mean, you know,
That
and
seems
the
easier.
person out there, the person out there that's doing that, that's clever, because they're just using Photoshop, basically holding the hands here. So I'll explain it. I do not do this, but they're holding the hands here while holding the, to take the first shot, and then they're switching out and holding the head. That's a Photoshop issue for me, and I just think that's madness. However, they probably are getting those perfect shots. Like I had a few wrinkles in the bottom of that, but my clients have never said, about that wrinkle right there. They see this and they want that magic. And we can pull that shot off in less than 4 minutes. Like we just have it ready to go. We're done, we move on to the next thing because we're pretty speedy. So it's a cool way to do it. And if it's the only option you have, I suppose you could do it that way, but there are other workarounds, I think.